I didn't check. The microphone is on.
But it's on.
It is on. I did not check ahead of time. I like to live life on the edge. And you know what? I throw caution to the wind when I go
That is
streaming.
your middle name, not mine.
Caution to the wind?
No, mine's caution to the wind. Yours is live life on the edge.
Live life on the edge. I love it. Welcome, everybody, to the Medicare Cafe pre-chat.
We were gone last week.
I heard things went really, really well with Clayton and Ben, though. So
what did they chat about?
They talked about, like, real-life applications of the things that you and I talk about each week. It's like, what happens if you do what we say? Some agents do.
Okay, yeah.
And then they find success.
There you go.
So that's what they talked about is some of those stories, which is really cool.
Yeah.
So welcome. For those of you who are watching the recorded version of this, we're going to gab for the next 5 minutes of just like updates. Because it's 9:55, I say local time.
Is
that correct?
In Central Standard Time.
As it would be, AKA right now. In Missouri, it's 9:55. And so we start Medicare Cafe at 10 o'clock, but we log on a few minutes early and just kind of chit-chat, talk about jib-jabs, any updates we have going on. So if you guys have any questions, comments, concerns, sets, or promises before we talk about our topic today, which is Medicare Supplements, make sure you can text us right here. I feel like
Vanna White.
Yeah, Vanna White adjacent. So text us, or you can write us a message in the message box, in the message machine. We'll pay attention to that as well. But I want to congratulate our favorite host, Miss Kari.
Too kind.
It's actually a really, really big deal. So Kari was reached out to from my local publication. We're in Columbia, Missouri, about 130,000 people, not including the masses of students that we have come to us. So we have a local publication called Como Insider, and Kari was actually selected, and they do like a faces episode. Kari was selected to be the face of Medicare. Yay! Which is a huge deal. So they go and they do like this huge write-up about her. She gets, her picture for it. We just saw the proofs of it, which is beautiful.
Looks really good.
So it's basically, she's going to be known as the local face of Medicare, which is huge.
It's exciting, yeah.
So how did you, like who do you know that's just like, first of all, face of Medicare, that's such a, like, niche, right?
So
there's a ton of Medicare agents here.
So I have a friend actually from my previous job. We kind of lost contact. I had reached out to her actually about talking about radio, and she was like, "No, we need you to be the face of Medicare."
You're wrong.
And
You're gonna do
this is the upcoming magazine, and it's just really cool because like the whole like issue I feel like is it's just they specialize on the face of whatever you're an expert in. And so there's, the face of realty, or the face of, there was one guy like the face of like vein care. I mean,
vein care.
That's
specific.
Yeah. And so I was a little intimidated by the like two pages. My face is one page, and then the words on the other. But yeah, I'm excited.
That's really cool.
I hope some business comes from it.
I'm sure it will. Again, that's like Columbia, the Mid-Missouri publication. So that's really awesome. And then
Thank you.
Are you gonna like go through and like see like who's are people that I can like network with? Like who can I say like, hey, you're the face of
I haven't even thought about that.
I'm the face of this. Let's get coffee together.
Have not even thought
That'd be
about
a really cool like opportunity to like connect.
Yes. Definitely need to do that.
Very cool. Well, congratulations. Again,
Thank
that is
you.
a huge deal to be recognized as that. I know you're the face of Medicare to us, but like now you're the face of Medicare.
No,
to, like,
I'm not. You are.
No.
Yes.
Very, very,
You've been
very
doing
exciting.
this 3 times?
I've been
twice
doing this
as long as I have?
Very
How
long.
many years?
10th year. I'd celebrate 10 years in January.
It'll be my 4th year in June.
That's nuts. Time goes by really fast.
It really does go by fast.
So I'm very excited for you, again, to see that success in not a short amount of time, but in a condensed amount of time like that. There's people who've been doing this for decades that aren't going to get that recognition.
Well,
so congrats.
Well, thank you.
Some other updates we have going on. Do I have anybody going to Medicare Con next week?
Oh, I thought you were going to say Capitol.
No, not that. Well, you are. So so Kari is a member of NABIP. Then how was
NABIP?
It was NAHU, National Association of Health Underwriters. Now it's
Benefits
Insurance Producer. I don't know.
Don't
It's
know.
basically like the new NAHU. They do like, again, so NAHU is an incredible organization that is pretty much the only one that like lobbies on behalf of insurance agents. They have a huge focus in the Medicare arena that's pretty new in the last 5 years. They've really transitioned into looking at Medicare related products. So I know you're going to go do that and actually be able to sit down with like the senators or who are you sitting down with? Or,
I don't even know. Just the people that have an impact in health insurance.
Yeah, very cool. Again,
So,
like
I'm excited for
they're
it.
the ones that are lobbying against the call recording. They did remove the scope of appointment 48-hour rule. So
I didn't know that.
Yeah, the NAHU was the ones who was responsible for doing that.
Did I miss that? Like, was there an announcement?
But I mean, that's old of not having the 48-hour rule anymore.
But I thought they were bringing it.
They are potentially bringing them.
Oh, well, that's what I was talking about.
Sorry, they haven't determined yet if that is. We hopefully should hear it.
Got it.
Actually, probably we'll hear it this month if the 48-hour rule is coming back.
Got me excited.
I'm sorry, we don't know. It's likely that's coming back.
Okay.
Yeah.
That's what I thought. So I was like, wait, they got rid of it?
They got rid of it the first time.
Okay.
Yeah. So again, interesting letters. They're also the ones that are like trying to get it to where not all calls need to be recorded, only sales calls need to be recorded.
Okay.
So we'll see some, like, it's give and take. I think we're still very much in the realm of like lockdown for compliance. We're not, I really thought this call recording thing was going to be done by this year. They're going to see like was ridiculous. This was too much. I was wrong. I think we're at maybe one more year of really strict compliance. I will say the numbers did improve wonderfully this year with
the complaints.
Yeah, but you also saw a ton of the big call centers get out of Medicare. So like not much of a secret as to why.
Okay, not to change the subject, but before we officially start, I have to tell you, Medicare Mama got banned from TikTok for life. For life.
Why?
I could not figure out why I couldn't see her stuff, and I like literally searched for her, and I was like, she's not on here. She's not on here.
I hadn't heard that. This is juicy gossip.
So
what
then
happened?
I found me, who hasn't even had TikTok for a month.
Right.
Hasn't even had it for a month. I'm a pro here. She started a new tag, a new name, whatever it's called, Medicare Family. And she got on there and said, all I saw was her little like title thing that said, I've been banned from TikTok. This is my new name. She said she posted there was some video with a child in the back who like didn't have their seatbelt on right. And so they banned her because of that.
That seems a bit dramatic. I've seen much worse.
Like, it doesn't even make sense to me, but was their like reasoning. So
well, there you go.
Yeah.
Interesting.
I know.
What a juicy little bit of gossip we had this morning.
Yeah.
A question we got was, just logged on, what recognition did Kari get? She is for Columbia, Missouri, the Como Insider. She was announced as the face of Medicare, which is, again, a really, really cool. Congratulations. That's a really big deal.
Thanks.
Before we get started, again, for anybody who is going to be attending Medicare Con next week at the MGM Grand in Las Vegas, just know Senior Marketing Specialist is going to be there. In fact, I actually will have a main stage talk. So if you guys... The main stage topic for Medicare Con.
What are you talking about?
We're going to be talking about how to take your agency and turn it into an empire.
Does that stress you out? Like, will you be nervous in front of that many people?
Let me write the speech first and then I'll tell you.
Okay. So wait, that's
yeah.
different than the Medicarian, right?
Medicarians is less of an agent-facing event as much as like FMO carrier networking event.
Okay.
That's going to be at the end of April. Also at the MGM Grand. So, yeah. So, yeah, very, very excited. So, if you're going to that and you haven't bought your ticket yet, just know that Senior Marketing Specialist, we do have a discount code called SMS25. So, then it gives you 25% off any ticket. So, just keep that in mind.
Nice.
Yeah. So, anyways, let's go ahead and get started. What were we talking about today?
Medicare Supplements.
Whoa, where did I go? We're talking about Medicare Supplements. And I haven't talked to Kari about this yet, but what I was wanting to do with this is actually kind of start a series and go into like different product lines. And so, let's talk Medicare Supplements.
Let's talk about it.
This is actually so how much of your business would you say is
You know
Medicare
what?
Supplement?
I knew you were going to ask me that, and I meant to look this morning.
Uh-huh.
I would say 80-20.
80-20. You have 80% of your business is med subs, and that's because you are working with the financial planners.
Yes.
And their clients tend to want that safety of, I'll pay high
and they can
upfront.
they can afford it. And then there's also just, I feel like, people that aren't affluent that still want that route. But the majority of them are from the financial advisors.
Got it.
Yeah.
So let's dig into it. First of all, for those of you, I know everybody knows what this is, but like, what is a Medicare supplement? The biggest thing with Medicare supplements is know that it is a secondary coverage to original Medicare. So that means that your Medicare is going to pay first, and everything after what original Medicare leaves behind is covered by the Medicare supplement, depending on what, I'm not good at this, depending on what, if you get an F, a G, or an N. We know F, G, and N are the three top most popular.
Yep.
G is running away with it. G has become the most popular in recent years. N is gaining some traction. Do you run Plan N?
No, I can think of maybe three times I've written it.
Yeah, I'm going to tell you. You need to look at Plan N. You're going to see a lot of carriers. Plan G right now is bleeding carriers dry because it's a guarantee issue plan. You're going to start seeing some pretty significant rate increases on G.
I feel like I've been seeing them this week.
Literally
this week.
Plan N's pretty safe.
Aetna and United Healthcare.
Yeah, exactly. Aetna, you're going to continue to see rate increases with Aetna. We'll talk about that here in a little bit. But yeah, Plan N is pretty safe from those because it's not a guarantee issue plan.
So tell me again how to get me better on selling ends. The Part B excess charges. Where can you find the list of doctors that charge that would be subject to that?
So for those of you who are unfamiliar with excess charges are, just know that it affects less than 5% of providers. 95% of providers accept excess charges. And excess charges aren't the same thing as like accepting Medicare. You're talking about two different things. You're talking about accepting assignment. So let's talk about what that is. The biggest time you're going to see that is Mayo clinics.
Okay.
But, so to answer your question, Medicare.gov, you can find a list of who accepts assignment on Medicare.gov. So whenever you're working with a provider that doesn't accept assignment, this is what this looks like, okay? Again, affects less than 5% of providers out there. What happens is that if a person goes to a doctor's office and that doctor does not accept assignment, what that means is if a person is on a Medicare supplement plan in, they will be responsible, that client will be responsible for 15% of the excess charges. So what that means, if I go to the doctor and let's just say I'm getting a hip replacement, and this hip replacement, the doctor is going to, or the Medicare can say, you can charge
$1,000.
Let's just go 100 because I don't like numbers. You can charge $100 for this hip replacement.
Okay.
Right? That's what Medicare says that you're allowed to charge somebody.
Yep.
If that provider says, I don't care what you say, Medicare, I don't accept your assignment. I imagine they're sassy. I don't accept your assignment, so I'm going to charge more than that $100.
Yep.
Then Medicare will say, okay, that's fine. On the Medicare supplement route, if you're on a plan in, Medicare supplement plan in will say, okay, that's cute. You can only pay 15% more.
Charge.
Yes.
Charge.
You can only charge 15% more than what Medicare is going to allow you.
Okay.
And then we'll pick up the rest of that.
Okay.
So that would mean that if my hip replacement was $100, they can only charge me $115 for that. So that $15 would be on a plan in, that $15, just the excess charges, would be the responsibility of the client.
Right.
So again, it's not a tremendous amount. Also with a plan in, you do have copays on ER visits and doctor's offices, only up to $20 for doctors, only up to $50 for ER. So yeah. So again, so that's why you're gonna see a lot of people moving towards a plan in. But just to keep in mind, here, let me go. Like make sure we have any texts. Here you go, you can read those.
Okay.
But just again, to finalize what's going on with the Medicare supplement, they are ran by the Department of Insurance. So that's why when you see these crazy marketing rules for, when you see crazy marketing rules for Medicare Advantage and PDP, those are managed by CMS. Medicare supplements are ran by the Department of Insurance. So they don't abide by those. Really? You didn't know that? No. So those, they don't abide by the same rules. You can kind of like do a lot.
Yeah, I mean, I knew that. Actually, that makes sense. That's why they have AM Best ratings.
That's exactly right. Yes, that's why they have AM Best ratings. So that's why, again, you don't have the rules and regulations. That's also why you're going to see some differences state to state. For example, some states like Missouri, if you lose Medicaid status in Missouri, that is not guarantee issue for a Medicare supplement. However, if you lose Medicaid status in Kansas, it is guarantee issue for a Medicare supplement. So you'll see some slight variations from state to state. The plans are standardized though. So I'm so bad at this. A plan G with United Healthcare is a plan G with Mutual of Omaha is a plan G with, insert carrier here, ACE. And so so just keep in mind that they are the same.
We do have a couple questions on
Perfect.
N. Is there a max for the excess cost for Plan N?
There is not.
There's
It's
not.
just that 15% extra. So
I feel like you're really going to get screwed if it's Mayo.
if it's Mayo, you
that's high dollar stuff.
Yeah, but
50% of that.
It is. That's true. But again,
Yeah.
it only affects 5% of providers.
Right.
And you can get a list on Medicare.gov.
Yep. Why does everyone shy away from Plan G high deductible?
So that's a really great question. I think a lot of people will shy away from the high deductible Plan G because they don't understand it. Not because it's not a good product, but it takes more explanation versus, here is your here's your premium, you'll pay the deductible, we're going to move on with our lives. I'll also mention high deductible Plan Gs have terrible commissions because the premiums are so low.
I didn't even know that.
Yeah, and
Makes
I mean
sense.
it's the same commission, but like you're paying it off of $40 versus $140.
Right. True.
So a lot of people do that. I like high deductible plans. The time where I see high deductible plans work, I'll say this: there are other options to high deductible plans that offer more bells and whistles. One, I'll say if you have somebody who's really interested in high deductible Plan G, look at a Medicare savings account because it works very similar. Plus, they're getting money put into that account by CMS,
right?
So they get more money, and it kind of works the same
HSA.
way.
Yeah.
It's an HSA,
It's
but
an
except
HSA.
Medicare funds it
Yep.
versus you and an employer. So they're just
I agree
alternatives.
completely.
There's an alternative to a high deductible Plan G that people tend to get more bang for their buck.
I've never enrolled anybody in a high deductible Plan G.
Again, it's a great plan. It makes sense for a lot of people, but you're not going to make a ton of money off of it. And again, there's other options that may have a little more bang for the buck.
Agreed. That was all the questions.
Those are the questions.
That was all of them.
Very cool.
So far.
Good job, guys. Good job. So that's the Medicare supplement. Again, last thing I'll mention about what a Medicare supplement is that right now it's hurting in market share. Medicare Advantage plans have almost 48% of market share. Medicare supplements have 26%. The rest of them only have original Medicare or are on like a group retirement insurance.
What?
Yeah, that number.
That number just really blows my mind.
It's actually lower than they thought. They expected to reach 50% this year.
Wow.
So, yeah. And again, that's obviously like dependent on your
crazy.
demographic. It's dependent on where you're located. But just nationwide, it's 26% MedSup versus 48% Medicare Advantage.
So I feel like, and maybe we'll talk about this later, but like when I look at my clients, the ones that have been unhappy or needy, not needy in a bad way, but just need more work, need more customer service. They're on the Advantage side. My supplement, I was going to say, is that across for you guys too?
Yeah, like that checks out. It's because they're more involved in their healthcare.
Right.
Both proactively and reactively. They want to use the bells and whistles of a Medicare Advantage. They want to go to the gym. They want their over-the-counter medicines. They need trained on how to do that.
Yeah.
And whenever they go to the doctor, they actually see bills from that. And that means that they're going to have questions and there's things going to be wrong. I mean, you're just going to be much more involved. However, Medicare Advantage plans do pay a higher commission. So it kind of comes out in the wash. You get paid more on a Medicare Advantage plan, but you're going to spend more time with your clients. Compared to a Medicare supplement, typically the commissions are lower, but it's kind of a right and do an annual review for them. They're kind of, you don't have to worry about teaching them how to use it.
I've had multiple, too many to count, clients who have literally just said, I like the easy. And that is like, I feel like one reason they're just drawn to a supplement.
So let's talk about that, because that's kind of what we saw what changed between why do people go to a Med Sup route versus why people go Medicare Advantage. People that you used to see go the Med Sup route were the more affluent. I could afford this, what they would call like a superior coverage. I can afford it, so I want it. Yep. Well, now, due to the bells and whistles of Medicare Advantage plans, people are actually referring to Medicare Advantage plans as the superior product. And people who are more affluent say, I can pay $3,900 if I go to the hospital. I can afford to do that. Let me go ahead and it's people who are low income saying, I don't know that I can afford to not have a premium and be stuck with this high out of pocket later. So you're starting to see a shift to people who are more affluent saying like, let me go ahead and get these bells and whistles and all these really cool things. And if I go to the hospital, I can afford to pay that bill. So you're kind of seeing a switch. So who is it? Again, what are the pros? to Medicare supplements, it's not going to be who makes more money, who makes less money. It's exactly what you're talking about.
Yep.
Me, I am a great MedSup client because I'm very lazy. If I'm being honest, I'm very lazy. I don't want to research networks. I don't want to have to worry about budgets. I don't want to have to worry about having a primary care physician for authorizations. I want to predict it, and I want to stay where I'm at. I don't want to shop for insurance every year. I don't want to have to go through the process every year. I'm very lazy. So right now, income and income amounts don't have a lot to do with Medicare Supplement versus Advantage. It's like, how involved do you want to be in your healthcare? That's what it comes down to.
Those 5 points are the 5 points I hit so hard that you just have on there.
Mm-hmm.
Number one, I always start with networks.
Mm-hmm.
I mean, especially, and again, maybe it is the more affluent clients I have, but they're spending their retirement years traveling.
Yes.
For sure.
Yes.
If I hear that, I over and over will say, this is what I recommend.
I couldn't agree more.
You don't have to worry about the networks. You know, when you're visiting your 4 children that are scattered across the United States, or your snowbird, or your Floridian, half the year, whatever.
I like that.
Absolutely. That's a no-brainer.
And that goes, like Dennis's point, he says, it's only easy until you cross state lines. Recently, 2 clients visiting their family in different states ran into coverages and issues with MAPD. Absolutely, because MAPD, now MAPD plans, we'll talk about this next week when we go over Medicare Advantage, but those plans do, like a lot of them, like the big guys, UHC, Humana, Aetna, have and started to invest in national networks. So you'll see that less, but you still have to be in a UHC network. So like you still are dealing with it. So yeah, I love that.
Absolutely. We had a question, can anyone get Medicare HSA? You mean the MSA account or plan? It has to be in your area. Still. It's still technically a Medicare Advantage plan, but acts like a supplement with a HSA.
They don't go by network, but they do go by service area. So it's still the same thing. Service area county. If there's a plan available in your county, then you're good. But they don't follow a network of doctors. They follow the same network as
around here. There's only one carrier that offers it, right?
Yeah, it was Lasso, but now they're called Zing. Yes. So Zing or Lasso, same
These people got to stop with their name changes.
I know. Looking at you, Ellaby.
We need to hit on number 3. That's my big dog.
That's something that I don't think a ton about. So I'm really interested to hear your perspective on this.
It's probably 75% of what sells a Medicare supplement for me. And maybe it's the way I'm presenting it.
So tell me how you
But it's the risk that I see. On original Medicare with a supplement, there are no prior authorizations.
When you say that to a client, do they know what that means?
Yes, a lot of them do. If they don't, I still explain. I'll say, let's say you need a knee replacement and physical therapy. It just happens. There's no back work by the doctor's office. There's no lag time. Lag time is the big thing for prior authorizations. And I'll say on Medicare Advantage, these plans are subject to prior authorizations. And I'll say some real world examples that I see, have seen over and over, is it always is skilled. I talked to somebody
all the time.
Just yesterday. I had a meeting with somebody who she literally grabbed her pen and put a big X on Medicare Advantage as we were talking. And she said, my sister got screwed so bad. She said they wouldn't approve surgeries. And she said the prior authorizations in the skilled setting. So typically, like, I guess what confuses me is original Medicare, like a Medicare Advantage plan is supposed to pay for what
at least
A
what
and
Medicare
B
does.
do.
Yeah.
And I think they'll pay it, but they won't approve those days.
Yeah.
So like over and over, if somebody is waiting to be discharged from a hospital to a skilled nursing facility, number one, it has to be pre-approved with your plan. And that I find takes a long time. I had a client that took it almost a week.
A for-profit organization to agree to spend money on you.
Yep.
I mean, like, so yeah.
Right. It takes a while. And then typically what I've seen more times to count is the doctor's requesting 30 days in a skilled. And the plans are approving 7 to 10 days.
Yeah. Again, because you're asking a for-profit organization to spend more money than you.
Right.
So you almost have to, like, prove, it's not just like, hey, they need this, and it's like, okay, perfect. They have to say, like, okay, but why? Why can you not do that in 7 to 10 days?
Yeah.
So yeah, that's interesting.
And I feel like when I'm talking, that sounded really biased the way I just presented that, but we're talking about supplements today. So I feel like when I'm presenting it to a client, I'm not that intense about it.
Sure, but
I feel like the
setting
example,
expectations.
well, one of the examples I like to give is the knee replacement, because I feel like so many of our clients need a knee replacement. They wait till they're 65 to get it. I'll say, you know, what that might look like is if you need physical therapy 3 times a week for 6 weeks following your knee replacement, on original Medicare, they're going to cover that. On Medicare Advantage, your plan might approve 2 times a week for 4 weeks.
Mm-hmm.
And we might not get that decision right away.
Mm-hmm.
So that's a less like intense example.
Yeah, that's a fair point, and that's real world what you see with that. Couple questions. Brad says, on the trial right, if a client has a plan F, do they have to go back to the same company with the same plan if it's available when using trial right? Yes, Brad. So again, if somebody is using trial right, which is there's 2 different types of trial right. There's original trial right and then trial right 65. This one's they're on a Medicare supplement. They go to a Medicare Advantage plan for the first time. They don't like it. They want to go back to that Med Sup. They have to go back to the same plan, same carrier. Now, here's the thing that's interesting about that. Let's just say you have
charge a different rate.
Well, it depends on the carrier, but oftentimes, yes, they do charge. They'll charge you the updated rate. So like it's not. Let's forget.
It's not like you're guaranteed your same rate.
Exactly, but like in Missouri, let's go back to a company that we had called Everest. Everest isn't here anymore. They don't sell new plans. Or even like if somebody had like an Aflac from back in 2012, 2013. We'll stick with Everest because Aflac is back, so that's a confusing one. But they go from it. They're on a plan F with Everest. Or even let's say like they're on a plan G. They're on any plan with Everest, right? They try a Medicare Advantage plan for the first time ever. They say, you know what? I don't like it. They have to go back to that Everest plan. Well, Everest doesn't sell insurance anymore. They don't have Med Subs here anymore.
Yep.
So what that does is that they'll say, okay, fine, you can go guarantee issue with any other company. It's guarantee issue though with any other company. If they qualify for a plan F prior to 2020, even if they had a plan G before, but if they qualify for a plan F prior to 2020, it's guarantee issue. So they only have plans A, B, C, F, K, and L. They do not have G.
Interesting.
So even if they had a plan G on the prior plan, it becomes a guarantee issue situation. If that prior plan does not exist, it becomes a guarantee issue situation. G is no longer guarantee issued. Of course, they could underwrite into plan G, but guarantee issue, they'd have to go A, B, C, F, K, or L. Interesting.
James said, my clients want to know their fixed costs for health issues and also appreciate the premiums leveling off at age 80. So they prefer the Medicare supplement plans.
Absolutely.
Yep.
Absolutely. And again, Dennis says, I
fixed
agree.
Cost for sure.
Exactly. So let's talk about some cons. Again, we're talking about why a lot of people go towards the Medicare supplements. Here's why people tend to shy away from Medicare supplements. One of them is going to be the no bells and whistles. I think that's like the biggest. No bells and whistles and higher upfront costs. I think those are the 2 biggest reasons why people tend to go towards the Medicare Advantage plan. They're saying like, I'm willing to take on more risks.
Especially the healthy ones.
Exactly.
I never go to the doctor.
Why do I need this?
Why do I need to pay that?
You're telling me that I can get money that goes towards, over-the-counter medication. I can get gym memberships for free. I can do all this on here. Perfect. I can get dental, vision, hearing, and pay nothing. Perfect. Get me there.
Yep.
And also a lot of people are saying, like, why would I pay $160, $190, $200 a month for something that, like, whenever my maximum out of pocket is only $3,900, $2,900 in this month. Like, I'm going to pay more in premium than I want on a max amount of pocket here.
Yep.
So a lot of times people do tend to go towards the Medicare Advantage plan for the opportunity to save money.
Yep, absolutely.
And again, we can't discount the bells and whistles.
We've got a couple questions.
Perfect.
How do they get away with not covering at least the 20 days Medicare allows? Don't know. That's my big question.
The biggest,
I don't understand.
The little amount of research that I've done to it is basically that you just have an extra opinion in there. The Medicare Advantage plan has an opinion that the doctor is asking this for 10 days. I think we can do it in 3. So it's just basically like the doctor, you still can get it approved, but it's a lot more work for the doctor.
I've had the doctor like write letters, like trying to get something approved at skilled nursing, and like
think about it like for like
plan still denies
exactly. Think about it like for like an employer plan, like if like a group health insurance or just like underage, like any type of HMO or PPO. You have to basically prove that you require that care. It's the pre-authorizations again. Like for example, I've had like some weird stomach things, and so I have to go and get like 3 tiny tests done that is like literally just time consuming, and it takes my time. There are appointments that I have to go get done, and my doctor's like, well, because we have to do this first before insurance will cover it.
Yep.
You just have an extra opinion there who doesn't care about the health side of it, just looks at the finances and says, these 3 tests or these like prove to me that you need something bigger than what
And
we've
a
done
lot
over
of
here.
people, exactly to that point, a lot of people, when I talk about the prior authorizations, they're like, oh, that's how it's always been.
Yeah, they're used to that.
I'm not used to anything different.
Yeah. I mean, and
And
that's
so they
where,
don't even think twice about it.
and that's something where, like, when we write Medicare
like,
Advantage plans, that's why they're rising in popularity. People are
Right.
like, this looks exactly like my health insurance I have with my
Yep.
employer. I get more because I get gym memberships and all this other stuff.
Right.
And I pay less.
Yep.
So, like, that's why people are buying
For sure.
them.
Yep. I feel like a lot of people, the prior authorizations either completely scare them or they're like, I've been used to that. So it's no big deal.
I know you got to get out of here in 6 minutes.
I do. Sorry.
No, you're good.
We've got another question. Most people that get MA plans don't know Medigap exists. 16,000 per rehab occurrence. 200 times 80 your lien on your house. There's not only death and taxes that you can't avoid, but also medical bills.
That's so true.
Yep.
And what was the question before that talking about?
20 days. How do they?
No, up here. There was something they said. Most people get MA plans that don't know.
Don't know.
You would be surprised on how many, when you're talking to consumers, they have no idea what they have. Like, you say, hey,
No
so
idea.
you're a Medicare supplement?
Oh,
Like,
yeah, I've got a supplement.
I got a supplement.
No.
And then it's this United Healthcare HMO
Yep.
plan, something like that. And you're like, no, but it supplements my Medicare. So,
Yep,
like, they have no idea what they have.
No.
So, again, just to continue some cons, reminder, they do require underwriting, usually. Annual rate increases, this is something that Kari said I think is a really big point, is that, like, you just set expectations.
For sure.
People, again, like, what insurance agents have done that kind of shot themselves in the foot is that we've only paid attention to premium, especially in those states that have anniversary rules or birthday rules. We say, like, I'll always keep you on the lowest cost plan. I'll always do that. And we really demonize rate increases. Deaf research show that people don't even start looking for shopping for new insurance until that rate increase hits about $25. So, like, don't panic.
Like that's accurate.
So don't
Maybe
panic.
15.
Yeah. They might, again, so don't panic whenever, like, you start seeing these rate increases, because you're just going to create a lot of unnecessary work for yourself. You're going to train people that, like, a $10 rate increase is the end of the world. They're just at the expectations that you're going to be seeing an annual rate increase. When it gets uncomfortable, let's have a conversation.
I talk about rate increases when I'm going over, like, my services. I'll talk about, I'm here throughout the year. We'll talk during open enrollment for your Part D or Advantage. And then I said, on the anniversary date of your policy, like, if you ever get a rate increase notice, feel free to reach out to me. If it's going to be a big one, typically I get notified and I might reach out to you. But you're going to have annual rate increases, but don't feel like you're ever
And just make
stuck.
sure in Missouri,
At
or,
least
like,
if you're in Missouri.
yeah, make sure that you're in other states that you warn them if they're going to get 2 increases. If you're in attained age state, that means that...
Tell me about that.
So there's issue
What
age
state
versus
you're talking
attained
about.
age. And again, I don't know specifically which one's which, but, like, if your premium goes up because of age. So then they get 2 rate increases a year. They get one because they get a year older, and they get another one whenever the book of business gets a rate increase.
So that would be attained age, I believe.
Attained age, yes, because it's the age that you attained. Versus issue age, which is whatever age you were issued at, you will not have a rate increase because you get older.
Right.
And that's
what Missouri is.
Missouri is
issue. I
issue.
think Kansas is attained age.
I'd have to look. I don't know for sure. So make sure you understand. But if you are in an attained age state, just let them know, set the expectations that they're going to be seeing those rate increases. Yeah. The last thing I wanted to talk about was just some industry updates, because again, we got like 2 minutes left. Biggest things right now, industry updates wise, Medicare supplement companies are all stressing. They're talking about they're having the biggest loss ratios they've ever had, and it's all coming from the T65 market.
Really?
And they said that's basically a leftover thing from COVID. People stopped going to the doctor during COVID. Now they're all going back, and these things are happening to them. Like, a lot of people didn't get preventative screenings. Well, now they have cancer because they didn't do that during COVID.
Gosh, that's sad.
Yeah, so we know during COVID was the lowest amount of Part B deductibles met. Now people are starting to get sick because they weren't going to the doctor then. And a lot of people are waiting until, like you said, they wait until they're 65 to get that knee replacement. Yep. So they're seeing our highest loss ratios ever in the T65 market. So you're going to start seeing a lot of Medicare supplement plans kind of go away from the T65. They don't want to be competitive there anymore. And you're going to start seeing them be competitive in the 70 plus. So just know there's some disruption coming there. Also, keep in mind what we've talked about in the past is that if you're healthy, go MA, because you're not going to, but a lot of your healthy clients want to go MA. All your sick clients want to go Med Sup because they're going to use the plan. Medicare supplements are feeling that. So they're experiencing in the midst of saying like we only have 26% of the market, that 26% are the sickest ones. So you're going to see Medicare supplements are struggling. You're probably going to be seeing some rate increases because a lot of them at that book of business is not a healthy book of business.
I'm so curious to see what happens over the next year or two as the Inflation Reduction Act, I feel like, is going to change Medicare Advantage plans more.
Exactly right. The Inflation Reduction Act, again, you're starting to see two things with the Reduction Act. One of them is that they're going to have to start taking a lot more medications under Part B. And so, again, they're going to be seeing, so they're going to be paying for that.
I was thinking how Medicare Advantage plans are going to be less
Medicare Advantage plans are going to hurt for a lot of different reasons. We'll talk about that next week.
Okay.
Medicare Advantage plans are going to hurt for a lot of different reasons, but Medicare supplements are not out of the woods for the Inflation Reduction Act.
True.
And the last point that I had on here was carriers. You're going to start seeing a lot of carriers come out with ancillary products. Example of cancer insurance, hospital indemnity, final expense. It's because they're hurting for premium, guys, and they want healthy business. So we need to be writing more ancillary product. Mm-hmm. You're going to see carriers really push their ancillary products because I think we are going to see Medicare supplement plans survive off the sales of ancillary products.
Interesting.
So that's it. Last thing on here, because we are out of time, but again, tips to write more. Do not sell on premium alone. If you only sell based on premium, you are completely eliminating the value you have as the agent.
For sure.
So don't sell on premium, sell on customer service, rate increase history, things like that. If you're going to teach people to only look for the lowest cost plan G, then what are you doing for them as your client?
Yeah.
Also set the expectations about rate increases. And I know Kari kind of talked about what were her big selling points for Medicare supplements and why that tends to dominate your
Another big selling point I use are real client examples to explain how it works. Because I feel like a lot of times people say, what do you mean my only out-of-pocket cost is $226? Like, that's my deductible or that's my cap? And I'm like, no, that's your cap. And I explain real life situations of mine, how that works. And they're like, oh, wow.
Yeah. Story sell.
Yeah.
People don't buy, and I think that's something to keep in mind. Like, I put on their brand. Like, brand is really important with Medicare supplements as well. People don't buy logically. People buy emotionally, and then they'll build logic around to support their purchase decision. So
that happened just yesterday. I signed somebody up for an Anthem Plan G. They were like 5th or 6th on as far as like cost ranking. But she was like, I've had Anthem for years. Let's go with Anthem. I know him.
I know him. I want them to trust him.
She was paying like, and it wasn't a huge difference. I think it was like $7 higher a month.
Brand is very powerful. Brand is very, very powerful.
There's also a huge percentage that have Medicare and a drug plan.
Yeah, it's as far as like the market share, again, it's one of the lower percentages that only has original Medicare with a Part D plan. Oftentimes those are your Medicaid people. They have the Part D because of LIS. It's not a huge percentage, but it's a good amount of people that don't have a Medicare supplement or an Advantage plan. So the biggest ones are going to be like people who are on a group retirement or like or a Medicare Advantage plan is where you're going to see the majority of
retiree plans around here have been changing. I don't know if you've heard.
I've heard snippets. I know that again, like a lot of them are dropping in benefits. A lot of these companies cannot afford to insure these baby boomers. There's so much interesting conversation of like what is the baby boomers, the largest
to society,
what is happening, and so that's also a really cool conversation of like the age bands and like what's happening to Gen X now that baby boomers are finally retiring. What's happening to the millennials in management positions? It's really, really cool.
Yes, agree, James.
Yes.
All right, sorry.
We gotta go, guys. Kari has to go.
Going to spend my day at the Capitol.
Go talk to the people of the Capitol. Kari is storming the Capitol.
Storming!
You've heard it here first. You all have a wonderful rest of your day. We'll see you next week. I will be gone next week. We got to figure that out. I'll be at Medicare Con, spreading my knowledge to the world. So
what do you guys want me to talk about next week?
Yes,
give me a topic.
I think you'll either have Ben or Clayton in here with you too.
Okay.
So what do you want them to discuss? We'll jump back when I get back to go over Medicare Advantage plans. I'll see you guys, whoever's going to be in Vegas. I'll see you next week in Vegas. And so until next time, have fun.
Make money.
And give impeccable service.